Of course, the holidays behind us, and that means it's time to bring in Dr. Joe Congini with us, Sports Medicine Center, Akron Children's Hospital, who's been part of this morning show for over 30 years at this time on Wednesdays. Dr. Joe, it's 2026. What do you have for us today?
Hey, Ray, I wanted to go back a little bit and talk a little bit about so much sports has happened in the last couple of weeks. But what I've probably been asked about the most is how decisions are made of when athletes need to be evaluated and when they need to come out of a game, when they can continue in a game, and how is all that delicate balance and decision-making made in sometimes seconds or minutes these decisions have to be made. And it's kind of some of the tension or interesting stuff of being on the sidelines is trying to make these decisions. I think everybody can kind of remember in their mind's eye a couple of weeks ago the great, very, very promising rookie for the Cleveland Browns, Carson Schlesinger, was out there and looked like probably a soft tissue injury, lower extremity injury. He was limping around the field. He really didn't seem like he could push off and play. Hey, how are these decisions made when you say you're going to allow somebody to play or not? Well, initially, a lot of it is the athlete themselves. As they get up from a hit or a particular play, they kind of make the decision, am I okay? Can I continue on? But it is a delicate balance. And so a lot of times when we're out there in a career, of 40 years, hey, somebody really struggling, don't make us look bad if you can't play through and do the things that you need to do as an athlete. So there's a little bit more leeway with an extremity injury, but a lot of times the athlete will try on their own, and if it's pretty clear that they can't play, they're struggling, they can't perform the skills of the sport, and they're trying to tough it out, the first person that does the evaluation, key person on the sidelines, is the certified athletic trainer. The athletic trainers, as we talk about all the time, they know these athletes, they live with them all the time, and they do these evaluations on a daily basis, too, of what are the skills of the sport. And so the first person usually to come to the decision-making process are the certified athletic trainers. They evaluate range of motion, weight-bearing, can they run? They evaluate strength. If it's an upper extremity injury, strength of the shoulders and neck and different parts of the body. And they'll make those decisions. And then the second part of it, can they perform the skills of the game, as I said before? If they're not altogether sure in this situation, time is of the essence. You have to make these decisions split second. Maybe you have minutes or so. You come over to the sidelines or on the field. You may have a little bit of input from the coaching staff. The coaching staff isn't making decisions, but they may have some input as to what the athletes look like normally. But then often the athletic trainers have a consultant with them on the sidelines. They may have a sports medicine doctor or an orthopedic doctor who now is going to weigh in and take a look at things in a little bit more detail. For that evaluation, some of it can be made on the field. Some of it can be done on the sidelines. There's enough room on the sidelines. Hey, put the person through some of the things they're going to have to be doing on the field. But sometimes that still isn't enough, and it's hard to answer the question, and these people have to be taken to the locker room. A lot of times in sports like basketball, indoor sports, they may try to loosen up on a bike or something like that, but there's not a lot of room for certain sports. But sometimes you have to go back to the training room or the locker room to help make these decisions. One thing that came about a decade or more ago is the blue tent. And so people always talk about, what's the blue tent? The blue tent on the sidelines. And so the blue tent is an area where instead of having to go all the way to the locker room or the training room, some of this evaluation can be done in a tent where people are not actually, looking in to see what the evaluation is, but the medical team is doing evaluation in the blue tent. It really started as a thing for concussion evaluation, but the blue tent is definitely used for musculoskeletal ankles and shoulders and other examinations as well. But definitely one of the things we didn't want 10 years, 15 years ago when these came up, Ray, we didn't want a concussed person running down back into the training room. A lot of them are dizzy, unstable, they have vision problems. So we wanted to do the eval on the sidelines, but you needed to keep the medical people on the sidelines too. So the blue tent has become a part of sideline evaluation. And again, remember, these decisions are made in short term, but in some situations after the blue tent evaluation, there's more eval that needs to be done, so people are taken to the locker room or training room. And a lot of people ask me, oh, my gosh, do you go back there? Do you do X-rays and MRIs and everything? Hey, man, I've been in the high school world for most of my career. Most everywhere that I've been in 40 years don't have X-rays in the locker room. Maybe occasionally for a big playoff game playing in a college stadium, there might be a place to do an X-ray. But, oh, my gosh, maybe a handful of a couple of times in my career have we had the benefit of X-rays. When you get into the professional situation, they may even have extremity MRIs to help them make some decisions, but not in the high school setting. So we take them to the locker room and kind of see if through some rapid icing, massage, treatments, taping, injection, could you get this person ready to be able to perform the skills of the game? It works a little better if it's halftime. You can do more, and you see guys come back out at halftime and they play again. But that's part of the evaluation. A really crazy story, and I've looked it up. You can look back. It happened at the Rubber Bowl not really early in my career. I looked it up, I guess 2002 it happened. A famous quarterback from the Thundering Herd of Marshall by the name of Byron Leftwich. And Leftwich got hurt in a game just before halftime in the Rubber Bowl. No X-rays or anything in the Rubber Bowl. The training staff took him in a car, went down the road to the Rapid Response, to a urgent care center to get an X-ray on his ankle. He returned to the game. You can see this there's still pictures of it on the internet, and he played the second half because it wasn't fractured, but his lineman literally carried him to the next play, and that shows up sometimes on films that they show of college football in 2002. He went on to be drafted by the Jacksonville Jaguars and played on 5 NFL teams, so it was just kind of an odd story there. But I would say in my career a few things. Hardest injury to evaluate. Concussions are really tough. It just is really hard to say whether people should return to play. We've learned a lot, but still we don't have all the answers. An evaluation of concussion is the toughest. And if there's any questions that it is a concussion, we've really kind of come around to this person shouldn't play. The hardest sport for me in my career, Ray, has been wrestling. Wrestlers have a timeline that we're allowed to evaluate, 90 seconds. And so for some of that time, they're talking to their coach, then a trainer will evaluate them, then somebody from the medical personnel trying to evaluate them in 90 seconds. You can ask for some more time, but they're very strict on time. And you'd see these wrestlers kind of writhing around on the mat in pain, and they don't look like they have strength, but you don't have enough time to really evaluate them. But if it's an extremity injury, you say, hey, what the heck, let's see what happens and start again. And all of a sudden they blow the whistle, and it looks like they're totally have their strength back and everything. So wrestlers are really tough. I want to give a shout-out to a new sport. I love new sports. You know that through the years with me, is in the last several years, young girls wrestling. Gosh, these girls are tough. And the girls' wrestling sport is really increasing and improving a lot, too. So I wanted to just give a shout-out, give an idea of what we do on the sidelines and out on the field and trying to evaluate. Should people like Carson Schlesinger be playing? Should people that are injured be playing? I wanted to give you a little bit of a look on that. But one final thing. I've mentioned the Rubber Bowl a couple times today. And the person who I remember most, who graced the sidelines at the Rubber Bowl, was a tremendous coach and a great man by the name of Jim Dennison, and we lost him in the last couple of days. He passed away. Coach Dennison, when I got to working on the sidelines in the late 80s, parents would come to my office, families would come, and they'd say, I want my kid to play for Jim Dennison, not just to learn football, but he teaches about life. And Coach Dennison taught a lot of life lessons. I got to know him very well. I got the benefit of him coaching my son a little when he started a program at Walsh University. So our thoughts are with the Dennison family today as well, and all those games at the Rubber Bowl. But I wanted to give you a little look in of that craziness that goes on in those seconds and minutes on the sidelines as people make decisions with medical teams about whether people should return to play or not.
Joe, one follow-up on that, because every person's pain tolerance is a little bit different. When it comes down to push and shove, and you're talking to Ray Horner and he's got an ankle, how much of that decision is left up to the player who's going to want to get back out there in most cases, and he's going on adrenaline, compared to the medical where they step in and say, no, you can do further damage? Is that a case-by-case thing, or does the medical coverage step in, severe sprain, no, and what if the player says, hey, I can deal with the pain? Does the medical staff still say no?
You know what, Ray? That is, you are always so right on target, and we need you with us on Friday nights on the sidelines too, because that's really a good point. And pain level really is a hard thing to assess. The only thing we definitely have to make sure that we cover all the bases are about the midway of this, when I said the athletic trainers and then with the help of the medical staff. You have to make sure that they, number one, we've done a full evaluation for range of motion, weight bearing, and strength. You can't let an athlete get back out there if they can't defend themselves. And number two, can they perform the skills of the game? And every game is so different. That's what's kind of cool about sports. And so if they have to fit those two criterion first. If they're still hurting some, but they fit that criterion, we may give them a chance from the standpoint of pain. But pain tolerance is such a hard thing to evaluate. You hit the nail on the head about why this is really a difficult job. It's an exciting job on the sidelines, but a difficult job. But the first thing is they have to be able to fit that criteria of passing those tests for strength, range of motion, and then performing the skills of the game.
All right, Joe, great information and good insight to what goes on, because we're going to really see it unfold here in the next few weeks in the NFL playoff season and the NCAA playoffs. You're going to see those very difficult decisions, Blue 10 and beyond, being made, and Joe kind of gave us the inside look on some of those conversations. Thank you, my friend. Always appreciate you taking time to visit the show again, Joe. Thank you.
Thanks, Ray. Sounds good.
All
Talk
right.
next week.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.